Okay, good afternoon, everybody. I think you know, I'm honored and privileged to be joined today by General Van Herk, the commander of U.S. Northern Command and NORAD. The general's got an update for you on his work for Operation Allies Welcome and all the good work that we're doing across bases here in the United States. The general will have some opening comments. I will turn it over to him in a second, and then we'll moderate questions and answers just like we've done before. I'll go ahead and choose you. Please identify who you are and what outlet you're with before you ask the general question so he knows who he's talking to. And we've got about 30 minutes for that. Then when that's over, I'll stay behind and we'll do some other business of the day here from the podium. General, can you hear me and see me okay, sir?
I have you loud and clear, and I see you just fine, John.
Turn the floor over to you, sir. Thanks again for joining us.
Okay, thank you, John, and good afternoon to all of you. Let me begin by just saying thanks for spending some time with me today and allowing me to talk about the amazing efforts that are taking place at 8 respective task forces across this country. The men and women at U.S. Northern Command, along with our many partners, are proud to support Operation Allies Welcome, and I'm pleased to provide you with an update on the efforts to date. As the lead combatant command for this operation, United States Northern Command provides oversight of DoD forces and activities in support of the Department of Homeland Security, the lead federal agency. While DoD is not responsible for the immigration process, we are working hand in hand with DHS and the other agencies to enable the process. We've built housing capacity, and we are providing our Afghan guests the environment they need while they work through the immigration process. Essentials such as a safe and secure environment, nutritious meals, warm clothing, primary medical care, and other services. Today, total capacity at the 8 different installations is over 64,000, and our Afghan evacuee population is approximately 53,000. More than 10,000 DoD personnel are currently supporting Operation Allies Welcome. Since we last spoke, my team and I have continued traveling to the DoD installations and task forces across this country. I've seen firsthand 7 of the 8 task forces, and I plan to visit the 8th task force when I visit Camp Atterbury in the very near future. Following each visit, I walk away impressed with how well the soldiers, sailors, airmen, Marines, Coast Guard members, and the interagency team are working together to ensure our Afghan guests, as well as the personnel supporting the mission, feel safe, secure, and respected. Now, before I take your questions today, I want to briefly talk about 3 specific types of issues that have generated a fair amount of attention in the media recently. I want you to have the facts about the good and the dedicated efforts that respective task forces and interagency teammates to address those issues. So I want to ensure you have that information straight from me. The 3 specific issues are the living conditions at each task force, the medical care, and vaccination efforts that are underway with our Afghan guests, and then finally, some of the law enforcement challenges we have seen and addressed at the task forces. First, let me talk about living conditions at the task forces. And I'd say they're similar to, and in many cases, exactly the same as conditions provided to U.S. service members during exercise and training missions. The task forces stood up to build 8 small cities under emergency conditions. While it hasn't been perfect, I have seen firsthand how committed our teams are to improving every single day. Our Afghan guests are living in a safe and secure environment with climate-controlled billets, eating 3 healthy meals and culturally appropriate meals each day, including 24/7 grab-and-go options, and enjoying recreational, classroom, and other activities. While areas for improvement are identified, either by the Afghan guests or task force teams, we work with our interagency partners, volunteers, and Afghan guests to address them quickly. My visit to Fort McCoy this past Sunday, which included interactions with the Afghan population, indicates they are grateful for the accommodations we're providing while they work through the immigration process. Secondly, medical efforts truly have been a good news story, and the health of our Afghan guests is a top priority. There are more than 1,700 medical professionals and staff attending to the needs of the Afghan personnel. Afghan guests have access to necessary medical services, including essential family medicine, pediatric care, emergency medicine, basic laboratory, radiology, pharmacy services, primary dental care, psychosocial support, and mental health services. Additionally, the U.S. government continues to take every precaution to stop the spread of COVID and other diseases consistent with CDC guidance.